I'm getting to it now. So the website I'm going to use right now, just to show you guys, like I said, I recommend using as many as you can. A lot of them are free. Is uniontestprep.com. I'm about to start the questions. I have not done these. Like I said, I'm just gonna do them. If I get it right, if I get it right, if I get it wrong, get it wrong. This is just a show. So let's press start. Question 1. What differences in a child's airway might make airway management more difficult than an adult? Well, I remember I took notes on this. It's right here. Child has a larger tongue in comparison to the body, and the child's upper airway is smaller and more flexible. So, this is right. Wrong. Wrong, wrong. So I'm going with this one. That was correct. Children have a smaller jaw, a proportionally longer tongue, which makes manual ventilation and intubation more difficult. Smaller teeth do not affect airway management. Let's go to the next question. A normal respiratory rate for an adult is blank, while a normal respiratory rate for a newborn is blank. I don't remember the numbers very well. I do know that children breathe more often than adults. I guess the regular for adult is like around 12 to 20, so I guess that's right. So I guess that's one of the options. And since I know children breathe more than adults, I'm going to pick this one. That was correct. Okay. This is the best choice given the answers, blah, 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 blah. And right here is some other explanation. Okay, let's go to the next question. What is the first thing you should do before inserting a nasopharyngeal airway? Well, honestly, the first thing I should do is, without looking at the answers in my head, is, oh my god. The first thing I can think is make sure everything's clear, patent, and honestly lube the nasopharyngeal, because you don't want any more bleeding to cause it even more airway obstruction. Okay, let's see. Tilt the head back, lube the airway, insert into the nostril. I automatically think that's the right one, but let's read the rest. Select the correct size. Oh man, I should have read the rest before I pressed it. I didn't think it would go through. Okay. Tilt the head back, lube the airway. Why was that wrong? Select the correct size, make sure the patient does not have the gag reflex. Look up to the nose, make sure the nostrils are large enough for the nasopharyngeal airway. Or Lord, there's different sizes for them. Oh, maybe it's select the correct size. Duh, see? Okay, let's try that one. Wow. That one completely went over my head. Crazy, right? I heard the questions are tricky like this. Okay, next question. Emergency care for patients who are not breathing adequately but have a pulse includes all of the following except ventilation support. That's definitely what they need because they're not breathing. CPR is only for people with cardiac arrest. Area management is supplemental option, so I'm guessing CPR because, you know, they're not going to cardiac arrest. You arrive on the scene to find a young woman who is having trouble talking. She has hives and is starting to gasp for air. Her friend says that she was just stung by a bee. Your immediate action should include all of the following except. Okay. Administer epinephrine. Administer supplemental oxygen, provide airway support, access to bee stings for a sign of infection. It's tricky because if she's allergic to bees, I would, allergy epinephrine. You're gonna need administer supplemental oxygen, so that doesn't even matter. Provide airway support, that kind of goes with the oxygen, and access to bee sting for a sign of infection. I feel like that's the answer because it says right here your immediate action should include all of the following except that's not really life or death, you know, like, you know, see if she has a rash right there. So I'm going with that one. That's right. You're called to a home and find an unresponsive male. Family members say he just passed out. You access the scene to be safe. The next thing you should do is get a temperature to determine if he had a heat stroke, check the patient's blood sugar, he might be diabetic, simultaneously check for pulse and breathing, that's definitely the one, and get a blood pressure to determine if it's too low and may have caused him to pass out. All of these could be an answer, but it says the first thing besides BSI is to make sure the guy's like breathing and he has a pulse, you know? So I'm going with that one. Okay, wheezing can be described as, well, I have a family full of asthma, so I definitely know this one. It's a high-pitched whistling sound. I should not be laughing, but it's funny because I listen to their lungs all the time. It's gonna be so embarrassing if it's wrong. Okay. Yeah, it's sad, but... Okay. You're responding to a call for a 44-year-old woman who's complaining of feeling anxious and states, I can't breathe. You should do the following. Immediately start manual ventilation since she can't breathe. I automatically think something's wrong because manual ventilation is usually when they can't breathe for themselves, like they're passed out. Perform an abdominal thrust. She may be choking. She's not choking because she says, I can't breathe. If she's talking, that means her airway is sort of kind of pain. It's just probably her lungs. Place a non-rebreather mask and turn the flow to 6 liters per minute. I agree with the non-rebreather, but I think 6 liters per minute is really low. And assess her respiratory rate and rhythm, check her oxygen saturation, and listen to her lungs. I'm gonna go with the non-rebreather one because even though I do think the thing is low, maybe that is normal for the non-rebreather. If she can't breathe, like the first thing you should do regardless is always oxygen. So let me see if I have it on my notes, how much the non-rebreather should be. See, non-rebreather is 12 to 15, yeah, I was right. Okay, so I'm just gonna go with the non-rebreather because, you know, oxygen first. Incorrect. What? So I'm honestly thinking that it's gonna be assess her respiratory rate and rhythm, check the oxygen and saturation. Okay, that makes sense now. You gotta go through BSI, make sure they're like, you know, pain, and then do your ABCs, which is airway, check if airway's pain, B, breathing, quality, and after that you put on oxygen. See, I forgot. It's been so long. So now I understand why. I think it's the next one. Is it gonna go? Yes. The patient is breathing since she is talking. There is no need for manually ventilate her at this time. You should perform a respiratory assessment, including checking oxygenation. Okay. When accessing breathing, tidal volume refers to, oh man, I'm so bad with these terms. How regular breathing appears, whether a person inhales and exhales. Okay, I think tidal volume either refers to the depth of the breath, or whether a person inhales and exhales for the same amount of time. Actually, no, that's rate, rhythm, and quality. Wait, rate. I'm gonna go with depth. Okay. You are treating an adult patient who is unresponsive and just vomited. Suction. Oh, you need to suction his airway. You should suction the patient's airway for no more than 15 seconds. I remember this. 10 to 15 seconds if it's an adult, and I think, less than 10 seconds if it's a child. I'm gonna go 10 to 15. It is correct. Well, maybe it talks about the children here. Right here, suctioning times are 10 seconds for children and 5 seconds for infants. Cool. Alright, If manually ventilating a patient, you should squeeze the bag every blank seconds for an adult and every blank seconds for a child. I like thinking. I can't remember this one. Like we said, the notes 1, 2. So I'm gonna go with, I know I'm like practicing how I did on the mannequin. I'm gonna go with 2 to 3. No. I'm gonna go 5 to 6 for adults and 3 to 5 for children, because children need to breathe. Well, they breathe faster and longer, or whatever. Ooh, let's go with that one. Ah, it's correct. Woo, okay. A nasal cannula can be run at how many liters per minute? Nasal cannula is right here. It can't take that much oxygen. Not compared to non-rebreather and a bag valve mask. So I think it was. I think this one's the 1 to 6. Or is it 1 to 8? I think it's 1 to 6. It's correct. 1 to 6. Cool. You are manually ventilating a patient who's using a bag valve mask. The patient is connected to a pulse oximetry and the oxygen saturation reading is 80. You do not see chest rise. What steps can you take? If you don't see chest rise, it means the oxygen isn't going to the chest, which probably means you need to recheck airway or like do the jaw thrust lift or the head tilt chin lift, depending on the situation. So let's see what the answers are. Repositioning the head and make sure you have a tight seat with the mask. That one's correct. Do a finger sweep of the mouth to make sure it's clear. Squeeze the bag much faster. No. Put down the ambu bag and start mouth to mouth. Definitely no. So it's between the first two, and I think the first one's more right. Yeah. Question 14. You're on a scene at a high school football game. A football player collapsed to the ground. He has a pulse, that's good. A respiratory rate of 4 breaths per minute, a little low, kind of very low. Breaths are very shallow and he's grunting slightly. Airway management should include placing a nasal airway in a non-rebreather with an oxygen flow of 10 liters per minute. I don't see why you need both. Administering supplemental oxygen with a nasal cannula at 2 liters per minute. Okay. Doing a head tilt chin lift maneuver, placing oral airway and transporting. Yeah, he's on the ground. Okay. Performing manual ventilation with supplemental oxygen. Is he unconscious? I'm not gonna I'm not gonna say doing the head tilt chin lift maneuver, only because he's grunting. That means he's gonna have an oral reflex, I think. So I don't think like the oral pharyngeal thing is gonna go. So I think for this, I would perform manual ventilation and supplemental oxygen, because his breathing rate is really low. So if you're breathing for him, it's probably gonna go higher. So I'm gonna go with this one. Yeah.